Today on Soma Says, I'm joined by Kristin Blake, a functional nutritionist and women's wellness coach who helps women heal from the inside out. Through her signature root cause approach, Kristin guides women struggling with fatigue, hormone balance, bloating, and burnout to reclaim their energy and confidence using personalized nutrition, lifestyle shifts, and nervous system support. Kristin, welcome to Soma Says. Welcome you to my podcast, Kristin. What inspired you to start Kristin Blake Wellness, and was there a personal health journey that led you to this mission?
Yes, and I find that so frequently amongst my colleagues is that we all have a bit of a story that brought us to where we are today. I started getting sick when I was a teenager, sick all the time, high fevers. I even passed out multiple times. I had rashes, and everything was just told to me as, oh, this is just normal. This is just the way you are. You just get sick a lot. And it was explained away. And I had accepted that was just the way it was. And then I got married and started having kids, and my kids started having a lot of issues as well. And we were also told, oh, it's just normal that your baby has eczema so bad that they're trying to dig their skin off and they're sick all the time. And I'm like, something in me just said no as a mom, where I accepted it for myself. I wasn't willing to accept it for my kids. And she started working with the players and their families on the power of nutrition and anti-inflammatory style eating, removing sugar from your diet, trying gluten-free, and all this whole new world for me that I didn't know existed. Because again, I was just being told, put the cream on the eczema and it's fine. So it really opened my eyes to the power of nutrition, and then also holistic functional health, where we're looking at the whole person, the whole body, and not just masking that one symptom with this one pharmaceutical or something like that. Turns out I had undiagnosed chronic Lyme and a whole bunch of other things that come along with that. And we were living in a moldy house that was really flaring everything. I had a lot of inflammation in my body. And once I finally was able to get better and my kids started getting better, we cleaned up their diet and my husband was feeling better, my kids were feeling better. Everyone around us was noticing, saying, hey, you used to be sick all the time. You had all this stuff going on. You seem better. What's going on? I started helping everyone around me. And then I realized, oh, I think this is my purpose in life. I went back to school and I started by getting a health coach certification from the Institute for Integrative Nutrition. And then I went on to get a master's of clinical nutrition and a master's of science in clinical nutrition and human performance, and then other specialty certifications along the way on gut health and hormones and things like that. Started off my practice small. I've now grown it to where we have an RN that works for us, an RD, 2 health coaches, and we all work together on really digging deep to help women be that resource that I didn't have back then and wished that I did, to figure things out a lot faster rather than being sick for 20 years first. Yeah. And so that's what brought me to what I do today.
I'm curious, what was your profession before you became a coach and a nutritionist?
Stay-at-home mom, really, but I graduated from the University of Maryland with a degree in criminology and criminal justice and psychology. And I originally was going to eventually start a career in psychology. My husband's career in the MBA was insane. We moved 20 times throughout his career. So I gave up on trying to go back to grad school at that point. So I put it all on hold and was raising my kids. And then that's when I found this new passion, and then went back much later to get a master's in clinical nutrition.
Okay.
But that psych undergrad was helpful because psychology comes into play a lot when it comes to our health and wellness. So that was helpful.
I'm mentioning the wellness aspect, right? Reading about you and your approach, you often describe your methodology as a root cause wellness. How do you define that in contrast to conventional methods, the conventional symptom-based care that you often find in medicine and other fields as well?
Yeah, I think of root cause as going as deep as we can to find what is the primary underlying driver of something. And then if we're able to resolve it at that level, we don't necessarily need that symptom-based care anymore. So one example that I like is acid reflux. So somebody goes and says, I have acid reflux. They're given PPIs, omeprazoles, Antac, things like that to block that acid. I want to know, why do you have acid reflux? And very often find that, which is going to alter your stomach acid production, and that could be contributing to the reflux that someone's experiencing. So once we find that H. pylori and we can treat that, then they don't have the reflux anymore, and then they don't even need the PPI or anything like that. Everything has pros and cons, and there's a time and a place for medicine, but sometimes they're used longer than we want them to be, and then we end up with side effects of that. Like PPIs, we can end up with iron deficiency anemia, low B12, things like that. If those are used for a really long time versus if they were used shorter, we figure out what's going on, and then we don't have to do it anymore.
And that approach that you have developed, was that something that you realized with time, with practice, or is that something that you always realized that, okay, I want to be focusing on the root cause and not necessarily treat the symptoms, the signs of whatever condition? How did that come about?
Part of it was the way that I was treated initially with conventional medicine. I felt like I just kept getting medications stacked on top of each other, and I never got better. And then when I found my root causes and I was able to resolve those, I didn't need anything anymore, and everything went away. I didn't have migraines anymore and all that fun stuff. And then the more that I worked with people and learned more about functional medicine and functional labs and what do we even have the capability to dive into and figure out, and utilizing that with our clients and getting exponentially better results, things we're resolving people didn't even know were initially a problem for them until after. That's when I really dove into that world of going as deep as possible. One example of that, my husband, he had knee pain because he was an NBA player for 13 years. Of course, you're going to have some joint pain. And then when he started working on his diet and removing the sugar and eating anti-inflammatory, he didn't start doing that for his knees. He started doing it for his elbow. He tore his ulnar collateral ligament off the bone in a game. And they said, you have two options. One is career ending, probably for him, surgery, a Tommy John surgery, or two is try Dr. Kate's dietary approach. And we did that and we came back. He healed his elbow and my knees are better too. So when we're going and addressing things a little bit deeper, instead of masking a symptom, we're actually supporting the body to work the best that it can. That's when I find you're fixing not only that problem, but then sometimes other things. You're like, oh, I didn't even realize I could fix that as well. And we're just getting so much better results that way.
And your practice, Kristin, is it more women? Is it men? Is it equal? Like how much are you seeing more women than men? What is the breakdown of your practice?
Yeah, it's mainly women. And then what we find is they want to bring their husbands after they start feeling better. So women are more driven to go and seek answers and fix their health. And so they'll come in and then they start feeling better. And they're like, okay, you got to fix my husband now. He thinks it's normal that he has diarrhea 7 times a day. And I keep telling him it's not. So I'm going to make him come see you. And so then we end up working with a lot of husbands that way. And also children too. So then once the moms see, oh, my kid's getting a little bit better from me changing my diet, which changed theirs, I think we're missing something else here. Yeah. And we're able to work with the kids, and kids are so resilient that you normally just have to tweak a few little things and they start feeling much better as well.
We were sharing offline, or I shared with you offline. I see a lot of women in their midlife, and there's a lot of women who are having hormonal changes, perimenopause, menopause. They have, for various reasons, fatigue, bloating, brain fog, and we're told that this is all just a normal part of aging. What are in your experience, some of the underlying nutritional and metabolic factors that we as physicians, nutritionists, nurses often overlook?
Yeah, great question. And midlife seems like it's a breaking point for a lot of women. Mm-hmm. They maybe haven't been feeling good for a while, but they're able to ignore it and dismiss it. And then once they hit 40s, everything feels like it's falling apart. And so that's when we see a lot of women come to our practice is they're like, yeah, I haven't felt good for a while, but now I feel like my world is falling apart. And so we'll dive in and, like you said, nutrition and labs and things like that. HRT, that's a side conversation, but that we often are recommending that women go and speak to their medical providers about starting HRT in perimenopause or menopause. And then nutritionally, people are pretty deficient by the time they hit that point. They're not really eating good quality food. And there's multiple problems with that. So one, if you're not eating enough nutrients, you're not going to have the nutrients. But then two, is if you're eating these kind of fake food replacements that are easy to grab and go, a lot of them have fillers, they have additives, they have things that can disrupt your gut microbiome. These artificial sweeteners are really great at disrupting the gut microbiome. And then we can see bloating from that or other downstream effects of a disrupted gut microbiome. So it really starts with what are you eating and what are you not eating? And that both can create problems. Are you not eating enough vegetables and you are eating a bunch of artificial sugars instead? We like to meet people where they're at. Our registered dietitian is fantastic at that. And she'll baby step them along to crowd out some of the bad foods and add in more of the good foods and make it easy for them to get those nutrient levels back up. Vitamin D, everyone seems to be very deficient in vitamin D, especially in northern latitudes, of course. So that's one that we're always checking, and that can contribute to fatigue and immune dysfunction and things like that as well.
So I'm going to ask you a two-part question. One is that you use functional lab testing in your practice. How does that differ from regular labs that you would order through, let's say, Quest or LabCorp? And then how do you use functional lab testing to uncover hidden drivers? And I'll choose something like blood sugar dysregulation, adrenal issues, thyroid dysfunction.
And they tend to just go that next level deeper beyond what you're going to get from LabCorp or Quest. So if somebody goes to their GI and they have certain bowel issues, the GI order a calprotectin, which is great. But we have a GI map or a gut zoomer or these more in-depth stool tests that have calprotectin and zonulin and secretory IgA and microbial imbalance and H. pylori. And so it's just going to go so much deeper and provide more information. Part of that is we have the time in a differently structured practice to go into that. I think that the insurance model makes the doctors have such a short time frame that they wouldn't have time to go over such an in-depth lab. And our appointments are 45 minutes to an hour long. So we're able to sit and unpack all of that and talk about what we're going to do about it and put together a custom step-by-step protocol using dietary changes, lifestyle modifications, supplements, things like that. The Dutch hormone test I really like for going deeper into hormones. If we're doing regular conventional testing for hormones, we're going to look at estradiol, progesterone, testosterone, maybe free testosterone in there as well. That's the end of the story. But Dutch, we can also look at those pathways that the estrogen can go down, and we can see how much is going down 2-OH, 14-OH, or 16-OH, one of which is highly implicated in breast cancer risk. The other one is protective. The other one tends to be more proliferative with the lining, and that can contribute to fibroids, heavy periods, things like that. So we can see not only what is your estrogen, but where is it going and how can we positively impact that? Maybe diindomethane is appropriate to kind of swing that pathway over, or maybe the COMT methylation is really low. We get to see that on there too. And then we can crank that up with a little bit of magnesium, B6. So it really informs a lot deeper of where we need to go with everything instead of just going, oh, there's a problem, but I don't know how to fix it. Functional labs are going to also show us where all the problems are, and then we can get in there much more strategically when it comes to fixing it.
Yeah. And unfortunately, these are not things that usually most conventional offices do or have the depth of doing. You were mentioning early on about gut health and how it's so important and how inflammation and eating processed foods can affect it. What role does gut health play in hormone balance and mood regulation during perimenopause and menopause?
I'm so glad you asked that question. I think it plays a massive role, and there's so many different reasons why. So one is I talked earlier about what foods are you eating or not eating. We also have to consider what foods are you absorbing and digesting. And if someone has really poor gut health and really poor nutrient absorption, maybe they have SIBO, which is small intestinal bacterial overgrowth, and that's going to contribute to not getting enough nutrients from our food. If we're not absorbing nutrients, then we don't have those building blocks, those little Lego blocks that I say to create what we need it to create. If we don't have enough selenium or iodine, our thyroid's not going to function very well. And then our metabolism is going to slow down and our hair is going to fall out and we're not going to feel good. And if we're not absorbing the nutrients from our food, we don't have those building blocks for all the different areas. Something else that we can see on the GI map that relates to hormones is beta-glucuronidase, which is going to dissolve this tag off of the trash that our body says, this, we want to take this trash out, whether that's hormones that have already been processed and we need to rid the body of those, or anything else that's gone through the liver for processing. Beta glucuronidase undoes that whole system, and then you end up recirculating the toxins through enterohepatic recirculation. So we can see if beta glucuronidase is really high on a GI map in the gut, and then that gives us clues that this person might not be detoxing very well. That could throw off their hormones. They could end up with estrogen dominance, and then that estrogen dominance is going to feel very PMS and not feel very good. Beta glucuronidase can be increased by a whole bunch of different gut bacteria. The ones in the strep family are really good at increasing beta glucuronidase. So if you've got these gut bugs, and that's going to create too much of this dissolving enzyme situation, and then you're going to end up with too many toxins, and even our own hormones can fall into that category, and you end up with too much from that standpoint as well. And then inflammation can also really start in the gut, especially when there's a lot of intestinal permeability. And we can have gut bacteria that are creating LPS, lipopolysaccharides. Then we've got this whole inflammatory system going on. And then that can alter our testosterone. And where that's going is that how much of our DHEA is sulfating into DHEAS, and all of those testosterone pathways, like the alpha pathway versus the beta pathway. And so all these pathways can get messed up if we have too much inflammation, or too much of a bad gut bacteria, or too much of a leaky gut, and we're not absorbing our food. So our hormones have this really delicate balance and dance that we want them to do, and they're not going to be able to do it as well if it's all gunked up by these things that really can all start in the gut and then end up systemic.
Yes, I think we're finding more and more how essential and important our gut is, especially the good gut bacteria that it's so easy to get rid of and so difficult to develop.
And I forgot the mood part, that we end up wiping out a lot from either antibiotics or birth control pills or glyphosate on organic food and things like that. And then we don't have enough of the good bacteria that we need to help make our neurotransmitters and really balance out our mood. And there's certain probiotics that have been studied to be mood enhancing. And that just shows the power of a good, healthy gut bacteria.
You often also speak about food freedom and ditching the diet culture. And I absolutely recommend that as well. When I ask women about what their diet is, they actually think if I'm asking them if they're on a diet. And that's how much it's ingrained in us that we should be dieting. How do you think midlife women can reframe their relationship with food in a way that feels nurturing and not punishing?
Yeah, I think the biggest thing is to remember that it is nourishment for your body. It is fuel for your body, and you want it to be nurturing. And women are often convinced that we need to be eating less. There's the whole eat less, move more that a lot of women are told when they ask for help with weight loss. They're often told, well, just eat less and move more. Hormones play a role. Thyroid plays a role. Your gut plays a role. There's so much else to it, but women are told that. So they end up eating less, and then they're eating essentially nothing. And that is the worst thing that they can be doing for themselves and their hormones and their mood and their gut microbiome. They need to be thinking of food as fuel and nourishment. You wouldn't put a car on the road with almost no gas on it and expect it to go. It's not going to go anywhere. It'll go a little bit and then it'll stop. And so we need to switch that mindset from food as something to fear and eat less of and be afraid of, and more it's fuel and it's nourishment. And the more real whole foods you're eating, fruits and vegetables and protein, the better off you're going to be with having the appropriate fuel in your body, and your body's going to work better, and then your metabolism's going to work better. And we always tell women, if they come, I have a form you have to fill out before we can start talking about working together. And on there, it discusses weight and food, and then we meet together. We are not a weight loss clinic. So if you are coming to us saying, I want to lose weight, yes, we can do nutrition, we can do diet, we have health coaches, but that's not our focus. Our focus is we want you to be really healthy. And then your body will find a healthy weight from that. But if you're hyper focused on, I need to lose weight, you're going to end up over restricting, and then you're going to end up eating bars and shakes, and you're going to make yourself so much worse. But if you just focus on the health first, everything else falls into place so much easier. And we have women eating more, double when they leave than when they came. And they lost 10 pounds from eating double, because we're able to give them the right food and the right macro breakdowns throughout the day, keep their blood sugar balanced. We love CGMs for that. If somebody it's not right for everyone, but for the people that want to do a CGM, it's great real-time feedback that we can look at and see, oh, when you ate that, that's spiking your glucose. That's not doing you any favors. We teach people how they can keep their glucose much more regulated and stable. And we see really great weight results from that. The focus is we want you to be healthy, have healthy blood sugar regulation, because that's going to give you good energy throughout the day, good fuel without crashes, and it's going to help avoid prediabetes. We don't want our insulin to go too high. So focusing on health, and then the weight can come after.
How do you help your patients rebuild that trust after years of being told that they should be dieting, that, as you said, eat less, move more kind of mentality? How do you gain their trust? Is it just by showing them, or perhaps sharing stories? How do you do it?
A little bit of both. It depends on the person. And that's the power of the psychology degree and motivational interviewing, and help figure out what makes them tick and how we can meet them where they're at. Some of it is stories and letting them know, hey, we've had this client that had the same exact problem as you. She ended up being able to eat more and lose weight. And then some of it is trust, building trust with them and meeting them where they're at. Instead of saying, let's overhaul your entire diet, they're going to feel really freaked out by that. So we'll start very slowly and say, okay, for breakfast, instead of skipping breakfast, I want you to have an egg and a handful of raspberries and a protein shake. And if they don't want to do it at first, but we're like, just trust me, give me just this one thing. And then they'll do that. And they're like, oh, I'm not tired all day anymore just from eating breakfast. And I didn't gain weight. I thought I had to skip breakfast or I would gain weight. And now I ate breakfast and I didn't gain weight. Wow, now I trust you more. And then we can alter their lunch, and then we can alter their dinner. So we can baby step it and meet them where they're at and get that proof for them. And then they're able to prove that to themselves.
What do you think in terms of progress towards healing, towards improving health? What do you think, what are the emotional or psychological patterns that most often sabotage women?
Negative beliefs, limiting self-belief. We do work with a lot of autoimmune patients. And so a lot of them come in over-identifying with their diagnosis and thinking, this is what it is. This is my life. I'm a lupus patient. I'm an MS patient. I'm a whatever patient. And they think that they're now trapped by that diagnosis. So being able to help them see, I can be a healthy person that has this diagnosis instead of just this is who I am, and see that they can feel better if they make these changes. We've had people that have been bedridden, and we start really small. We're like, we just want you to get out of bed and walk to the fridge in the morning and open it up and get yourself a meat stick and a cheese stick to nourish yourself, and building on that to show them you can do this. You thought you couldn't, but you can. And let's overcome this and break out of that mindset of being stuck where you are. They believed that. So we want to help them shift into, you have more power than you have power to change your life, power to change your health, your weight, your inflammation status, your CRP. We can help you make your CRP go down if we can teach you how to eat anti-inflammatory, things like that.
So it's really interesting that your approach, because I think it does intersect with how I practice. Some things obviously we do differently, but one of the things that I think we share in common is it sounds like you do focus a lot on stress, and especially chronic stress, right? How do you feel that it impacts women in terms of affecting their metabolism, their cortisol, their cravings, their energy? What have you seen in your practice?
Yeah, I see the opposite of what a lot of people are talking about on social media. I think it's because they're selling supplements for it.
Okay.
So everyone's talking about, oh, you have high cortisol. If you're stressed, your cortisol's high, your cortisol's high. And then when we test it, especially on the Dutch, we can see the diurnal pattern of what it's doing throughout the day. We, at least in my practice, we very often see just flatlined. Their cortisol is so low. Occasionally we'll see high free, low metabolized, which that pattern usually is a thyroid dysfunction, and that triggers us to do some blood thyroid testing. What I see more commonly than anything is people's cortisol is just, it's really low, it's really flat. They don't have that cortisol awakening response that you're supposed to get you up out of bed in the morning. Low cortisol awakening response is correlated to a worsening of autoimmune disease symptoms. So that's something in my autoimmune population we definitely want to work on. But I hear a lot on social media, people saying, everyone's cortisol is high and you should take phosphatidylserine to lower it, or you should take this or that to lower it. And I freak out because I'm like, wait, did anyone test? If it's
Yeah.
low and you take something to lower it, you're going to be even lower. You're going to feel terrible. So I see that women have burned the candles on both ends to the point where their cortisol is not doing what it's supposed to. Their adrenals are not well supported and it's lower than it needs to be versus high. Maybe 5 years ago it was high, but a
Yeah.
lot of people midlife are burnt out. They're doing all the things at work and at home and everything, and that cortisol is really low. And so we want to focus on how can we nourish their adrenals, nourish their body. There's adrenal cocktails that you can do with a pinch of salt and baking soda and things like that. And to scale back those workouts. A lot of people are doing HIIT and CrossFit and Orange Theory, and they don't believe us when we say this might not be good for you. And then we get the Dutch test back and I show them they have no cortisol. I'm like, see, your adrenals are not happy right now. They're not making DHEA. They're not making cortisol. You need to calm down, calm everything down. I have two sisters that come to mind. They're twins that we worked with, and they both were high achieving, go, but super depleted, exhausted, could barely get out of bed. One had kids and she was like always cranky with them and just felt terrible all the time. Both of them had low cortisol patterns. Both of them were go. And we were like, I know you're not going to like this, but can you stop with all the HIIT and all the things for a little bit? Give me a couple months of walking, yoga, Pilates. I'm not saying you can't work out, but just tone it down, be more nourishing and gentle to your body. And they both felt so much better. And now they're able to find a balance where sometimes they do HIIT, sometimes they do Pilates, but it was just go depletion before, and they didn't realize that was negatively impacting their cortisol and their overall health.
You've also written about the importance of slow mornings and the nervous system support. So what do you recommend to your patients for simple daily practices that they can do to help with the depletion, this dysregulation that happens in midlife?
Circadian rhythm, I think, is huge, and having a time that you do things that is the same is so helpful. So waking up between 6 and 7 every morning and going to bed between 9 and 10 every night, or how everyone's different with how much sleep they need, but trying to keep that consistent, trying to wake up at a normal hour if you're able. And if you can maybe skip your 4 a.m. workout and get up at 5:30 instead, you're doing two helpful things for your adrenals. You're not waking up as crazy early, and you're going to give your body a little bit of a break. And then I want them to go outside and get early morning sunlight on their eyes, because that's going to tell their pineal gland to stop secreting melatonin, which is going to help shift them into, oh, I'm awake now. Because cortisol and melatonin are like a seesaw. So you have to tell your body it's daytime. We don't need melatonin. We need cortisol. So we want to regulate that back in the body again. We are often on our phones, which have the blue lights, which is going to alter that. At night, don't be on your phone. Don't look at your laptop or your TV, or at least put on blue blockers. Go to bed at a decent hour. In the morning, go get some sunlight on your eyes so we can switch that melatonin off, turn that cortisol on. Don't chug 4 cups of coffee on an empty stomach. Get some food and you eat breakfast. Just nourish your body. I feel like when I say it, it sounds really simple, but it actually is really impactful to have these simple nighttime and morning routines where you're nourishing your body and you're not pushing it so hard.
Yeah, absolutely. Yeah, and in that way, you and I are both advocates for integrative care, combining functional nutrition with medical insights. How do you think that nutritionists and physicians can collaborate more effectively for women's health?
You tell me. That's a great question, because I love when I am able to have that collaborative relationship, and that's not always available to some of my clients. They've come to me because they've had negative experiences with their doctors where they've said, I want to try diet and exercise. And they're like, no, you just need to take this pill. And they're not open to other things. I don't know how to bridge that gap all the time. But when there is that collaborative relationship, it's so helpful and amazing, where we're able to all come together on patient care and tackle it from all angles, with conventional labs and conventional medicine where appropriate, functional labs and nutrition where appropriate, diet and lifestyle modifications, and working together, I think, is amazing.
I think so too. You were mentioning one thing about social media and how you find that, at least when it comes to cortisol, some of the misinformation that's reaching women. What are some red flags that you see, like what that you mentioned? What are some red flags when women try to self-diagnose hormone issues online? And how can they find credible guidance instead?
Yeah. One big hormone thing that also drives me crazy and freaks me out is everyone should take DIM if you have
Yeah.
PMS. I
Yeah,
don't
yeah.
agree with that. You have to look at all the pathways and make sure COMT is working before you just start dumping everything down this pathway with DIM. So I am definitely a fan of working with a provider when it comes to hormones because there's so much that can go wrong if you're not doing it right. So I don't love self-diagnosing for people out there with their hormones. And so just asking really smart questions of your provider to see if that's going to be a collaborative relationship, testing hormones, or how do they feel about the role of diet in hormones? And are they open to discussing bioidentical hormone replacement if necessary? I've had some women come to work with us and all of their hormone levels are in the tanks when we treat them or test them. They came to us because they went to their doctor and they said, I feel terrible. I think I'm in menopause or perimenopause and I have night sweats and brain fog and I feel awful. Can you test my hormones? Can we try hormone replacement? And they said, oh, you're not old enough yet. You don't have that. Go home. It's in your head. And so that's obviously not going to be a collaborative, helpful relationship. So getting to find a provider that you feel heard and you feel is listening to you and you guys can work together on it to explore what is actually going on in your body and what's going to be most supportive for it. And I'm excited, as you probably are, about the new changes with taking off the black box warnings, estradiol patches. That was a myth for a while of, oh, this is so bad for everyone. And it's more nuanced. And you should be able to find a medical provider that knows the nuances of what's going to be right for you and what's not, and help guide you through that and your family history and your genetic risk. And there's a lot to that.
I had a patient who freaked out about the estradiol cream, vaginal cream that I had prescribed for dryness in the vagina. We called called atrophic vaginitis, but it's the now it's being termed the genitourinary syndrome of menopause. And she was like, I'm not using it. It says, and I said, you know what? It's going to happen in a week, likely, where it's all going to change. But I can tell you, can guarantee you that is very incorrect. So obviously there was a big disservice when all those changes happen.
And that's such a helpful intervention. That vaginal estrogen is a game changer for so many women in so many different ways.
Midlife is often described as a second puberty. How do you think we can get women to embrace this transition rather than fear it?
Information, education, educating on you don't have to be afraid of this intervention, this vaginal estrogen cream, and explaining to them why and how does it work in the body and how can it increase lubrication and the way the tissues work and avoiding that dryness and pain and things like that. I think just education, empowerment, and information is a great way to go about it.
Yeah. When you see your patients and you talk about healthy lifestyle, right? Healthy living. How do you practice in a way? We live in a world, in a society, I should say, where aging isn't always equal to good stuff. Aging is not always good. And obviously, there are things that happen as we get older, certain things that we have certain risks in terms of health conditions. But aging also brings wisdom and it brings a lot of experience. What does aging mean to you beyond what we've been talking about, the numbers on a lab test or the weight on a scale? What does that mean to you?
One thing that I always think about is what do I want to feel like when I'm in my 80s? And I want to improve my health span, not just my lifespan. So taking with me the knowledge, the wisdom throughout my life, but being able to then still be very present and active to be living that out. And I picture one day having grandkids and great grandkids, and I want to be on the floor rolling around with them and not be afraid I'm going to break a bone. And so I want to focus on my health now to set myself up for the health in the long haul and not be at high risk for osteoporosis and things like that. So I really think of health now as an investment in my future self and who I want to be and how I want to live my life to the fullest throughout my whole lifespan and not just live life really good now and then decline. I've seen videos of women in their 90s like lifting weights and getting up and down on the floor still. And
Yeah.
it's so inspiring to me. And that's what I aspire to do, is to be healthy as long as I possibly can, to really get the most out of life and everyone around me.
So in that vein, if listeners were to take one lesson from the conversation that you and I are having about their bodies, what would it be?
I would say focus less on appearances and more on the actual health inside of your body.
Yeah. And what's a common myth about nutrition or hormone health that you'd love to debunk on this podcast once and for all?
One size fits all is such a myth. And you'll see people out there selling their diet book or their this or that. And it's everyone should eat this or everyone should eat that. And if you dive into the genetics, that is not true. Let's take a vegan diet, for example. Some people might say they feel good on it, but then somebody else, if they have that gene where you're not as good as at converting your ALA into omega-3s, or your, what's the other one? Beta carotene into vitamin A. So there's genes that encode for this, and you might not be as good at turning the plant version into the one your body actually needs. So for you, a vegan diet would make you feel terrible. So I think there's no one size fits all diet. Everybody's bodies are different. Everyone should be keto. That's a myth too, where carb tolerances are different. Our blood sugar regulations are different. Our genetics are different. Our health history is different. Our family history is different. There's so much that goes into it. And I'm a big believer of finding what works for your body and makes you feel best, whatever that looks like for you, whatever data you have available. Some people have the ability to run all of the fancy labs and the genetics, and that's awesome. But if you don't, you can still eat certain foods, see how you feel, go through different time periods of eating different ways, see how you feel. And you can use your body as a marker as well. The myth I want to throw out the window is that there's one diet that everyone should eat. We do know a Mediterranean diet has a lot of benefits to it. That's the one that I'll give somewhat of a pass to, but I still think that it should be individualized and dialed in from there based on your individual body.
And finally, Kristin, what's next for you and for Kristin Blake Wellness?
I love what I'm doing, so I want to keep doing it. And I would love to keep expanding my team so that we are able to meet with even more people and help them find what is their root cause, why don't they feel good, and how can they resolve it at that deeper level to set them up for a lifetime of health moving forward.
And if my listeners were to look for you, for your website, your social media handles, where could we find you?
Everything is my name, Kristin Blake Wellness, and my website's www.kristinblakewellness.com. Instagram is the same. YouTube is the same. Facebook. So I'm Kristin Blake Wellness everywhere.
Thank you so much to Kristin Blake for sharing her wisdom on healing from the inside out. Her approach reminds us that midlife is not a decline. It's an opportunity to nourish, rebalance, and truly thrive. To learn more about Kristin's work, visit KristinBlakeWellness.com. And if today's episode inspired you, please subscribe, leave a review, and share Soma Says with another woman who deserves to feel her best.